Kidney-friendly superfoods. The first on top of the list are apples. Apples are a good source of pectin, a soluble fiber that can lower cholesterol and glucose levels. Blueberries are also a low-calorie source of fiber and vitamin C, hence make it to kidney-friendly superfoods. They have potential to protect against cancer and heart disease and for possible brain health benefits. Spinach, yes, spinach. It is high in vitamin A, C, K, and folate. The beta-carotene found in spinach is important for boosting your immune system, health, and protecting your vision. Thank you very much for staying with us on Focus on Health. So that was the Healthy You segment, and I hope you've learned a few things, one or two things about your health, and you have come out educated after you watched that. So continuing with the conversation that we are having before the break, we're now joined by Dr. Mercy Origa to just shed a little bit of more light on transplant education in Kenya. So thank you very much, Doc, for joining us for this particular interview.
Thank you, Omar.
Yes.
Yes, I'm happy to be here.
Thank you very much. When we talk about transplant education in Kenya, do we think as a country we've gotten to that place where we can say that everyone knows about transplant?
Not really. As much as kidney disease has become very common to our population, I think we are still not aware that we can actually do this as a country, and it's very possible to do transplants locally. Because people don't really think we have the facilities to do so. But doctors have been trained in the line of it, and we have very capable doctors who can be able to do transplants in Kenya. Yes.
And when we talk also about these things, then something also that you've mentioned is about the infrastructure. Do we have enough dialysis points, and of course enough hospitals to do these transplants in the country?
Yes, as in the health sector, we are really trying, because we see kidney failure being very common, and therefore you'll find most facilities, at least in each county, you can be able to access dialysis. Yeah, so most of the time dialysis might not be an issue, but the issue would come about because of transplant, the transplanting option. And that we do in the major hospital facilities, for example, Kenyatta National Hospital and Moi Teaching and Referral Hospital, and of course the private facilities, Aga Khan University Hospital, we have MP Shah Hospital, Nairobi Hospital, and other small private facilities. Yes.
And talking about cost, maybe will you comparing cost in the private and the public facilities? There have been issues of people who are waiting for a very long time, almost 1 year to go to have their transplants done. Talk to us about the costs.
Well, of course, it's always cheaper to do any sort of procedure in the public sector, because that's where people are able to finance themselves without the help of probably an insurance company and etc. So most of the time, and you know, we are not doing well because the numbers are very huge. Not everyone can afford to go to a private facility. Not everyone can afford the services offered in the private facility. And the prices are normally subsidized when it comes to the government facilities. So the public sector is actually more feasible as compared to doing whatever procedure in a private facility. Yes. And
you as a doctor, you have been in this field for, I guess, a couple of years, or you have been in the field generally. So what is your work as a doctor in terms of education on transplant?
So first thing first, we need to find out what exactly is the cause of the kidney failure. If a patient comes to me, I need to first try and understand what are the risk factors, what led you to that, and now your options available. Sometimes dialysis cannot be the option for you, and a transplant, especially in acute traumatic kidney injury. So transplant would come therefore as the first option. So it's my role as a doctor to give you your options, and to make them available for you and to prepare you for the transplant. What you need to do, the medications that you need to be on, the kind of diet that is involved, the risk factors. I need to tell you what to expect and what will happen beyond and after your transplant. We also need to find for you an appropriate donor, meaning now we need to go into the logistics of family. We need to find out if you have someone who can give you your organ, yes, as needed. Yeah, so that's basically our role.
And when you talk about how do you match that this donor will get will receive an organ from this, how do you match the donor and the recipient?
So there are various tests we need to do. First being the group compatibility testing, to be able to justify that your organ will not be rejected by the recipient. Then there are blood tests that we need to do to find out if the organ and the recipient are compatible. In terms of infection, we need to look out for certain viruses like HIV, for example, CMV, EBV. We also need to ascertain the health.
Just as you also talk about that, you talked about CMV and EBV. I think you were losing our viewers for those. Could you try break them, CMV and EBV?
Those are viruses majorly. The CMV is cytomegalovirus, and EBV is Epstein-Barr virus, which are, they belong to the herpes family, and normally they're transmitted through things like organ donation, blood transfusion, etc. So those are some of the things that we need to screen our donor for, and also the mental aspect of our donor, so that we don't get into mental problems post-transplant. Yeah.
And just as we come to the end of this also, tell us a little bit about the consent. Most of the donations that are happening in the country are between close family members.
Yes.
Yeah. Can somebody who you don't know give you an organ and you actually receive it?
No. In Kenya, the law really has limited us to your family. So someone who's not your family cannot donate an organ to someone else. Yeah, so we have not really, the law is still vague about it. So we are not...
We haven't really gotten there.
We don't really have something that, we're not there yet. Yes.
And as a doc, what do you think should be done so that, because people are really suffering, what do you think, as somebody who is in this particular field, what do you think should be done so that we can be able to get all these things without really having to struggle so much, especially for the people who are really in dire need of these particular organs?
So I think maybe educating the public of what people who require transplant actually go through in terms of the financial aspects, because it really has an impact on them, on their families and their friends, because after transplant there are certain things that still need to be done. It just doesn't stop there, because there are medications, lifetime medications that they're normally on. There are still tests that need to be done post-transplant. Also the well-being of the person. They need to eat well, they need to exercise, and that is all. It all requires money. So we can actually educate the population about it, try to get some financial assistance from people, some organizations that can support these people, and basically stuff like that. Yeah. And
lastly, any challenge that you may give out to the government and maybe some organizations out there in terms of organ transplants in the country?
I think we need to reach out, especially the government needs to reach out to certain to these people because of the financial aspect. Not everyone is able to fly out for a transplant. So if we are able to do it locally, the better. So I think organizations need to reach out to people so that people can actually get help and the quality of life can improve for them as well. Yes.
Thank you very much, Dr. Mercy. So that's all we had for you on Focus on Health on this particular week. You know, we've been talking about organ education in the country. So if you are a leader out there and you've been able to watch this, so the ball is on your court so that you can be able to at least push the legislation through, so that the people who are suffering can at least have a new lease of life. So I'll be leaving you with the Didino segment. My name has been Omo Nyango. Keep tuned on KUTV. That's my time. Bye. Dietary Guidelines. Salt or sodium is a major cause of chronic kidney disease, high blood pressure, and heart diseases. Restrict your daily intake. A high salt intake causes fluid retention. Don't add salt after cooking. The lesser, the better. Low salt substitutes are no good either, since they contain high levels of potassium.